Hi, everybody. This is Dr. Karkhanis with Allergy SA. A very warm welcome to everybody who is logged on to our session. It's Allergy and Asthma Awareness Month, and today we are going to talk about how your asthma control is measured. Is your asthma controlled? I have a few informational slides, and then Dr. Diaz from Allergy SA will be joining us, and we will have a question and answer session. So, as you watch my slides, if you have any questions, you can put them in the comments section and we will answer them later. So let's start talking about asthma. Okay, let's see. So what is asthma? So asthma is a chronic condition. It's a long-term condition that affects the airways in the lungs. Your airways are the tubes in your lungs that carry air in and out. And if you have asthma, the airways can become inflamed and narrowed at times. Asthma can affect people of all ages and often starts during childhood. You may wheeze or cough or feel tightness in your chest. Those are the common symptoms of asthma. They can range from mild to severe, and they can happen every day or only once in a while. So, asthma can present in various different ways. There can be certain things that set off or worsen asthma symptoms in particular patients. For example, cold air. These are called asthma triggers, and when symptoms get worse, it is called an asthma attack. Keep in mind, not all asthmatics have asthma attacks. Some may only have a chronic cough and may never present with a typical attack, especially children with asthma. So, when you go to your doctor who takes care of your asthma, you will often see them handing you a questionnaire. And these are some common examples of asthma questionnaires. We have one called the Asthma Control Questionnaire, which has about 7 questions. There is another one called the Asthma Control Test, which has 5 questions. You have one called the Asthma Therapy Assessment Questionnaire, which has about 6 questions and a little more detailed information. But this is how your doctor tries to check if your asthma is under control. So, what is it that we ask you? What are the main ways that we are trying to check if your asthma is under control? These are the main things we try to check. So, when we are looking for asthma control, we look for impairment in your life that asthma is causing and the risk in your life of having an asthma flare up. For impairment, we are basically asking you, how often do you have asthma symptoms during the daytime? How often do you have asthma symptoms in the night? How much is your normal activity affected? How often are you using your rescue medications? Then we do a lung function test and we look at the numbers to see what your lung function is. As far as risk is concerned, we are trying to determine how many asthma exacerbations or flare ups do you have in a year that require steroids, either oral steroids or steroid shots. These are the main determinants that tell us if our asthma is controlled. And once we get those questions answered, depending on your age, so for 0 to 4 years of age, 5 to 11 years of age, or 12 years and above, your doctor basically plots you in one of these asthma control charts published by the NIH. And that's how we know, is your asthma well controlled, not well controlled, or very poorly controlled, depending on your daytime symptoms, nighttime symptoms, rescue medication use, interference with daily activity, lung function, and then risk of flare ups. This is how we determine if your asthma is controlled. So, how can you control your asthma? What can you do to better your control? Know your triggers and avoid them. If you suspect allergies, see an allergy specialist, consider getting tested. Common triggers are dust mite allergens, viral infections, cigarette smoke, air pollution, pollen allergy, mold allergy, or pet dander allergy, like dog and cat dander allergy. Take your asthma medication as prescribed by your doctor. A big component of asthma medications are your inhalers, and many of these are your controller inhalers, your preventive medicine that you have to use every day. For many patients, you cannot take asthma medication only when you flare up. You have to take it on a daily basis. So, if you look at the chart on the right hand side, you have some inhalers that are labeled as inhaled corticosteroids. These have very mild doses of steroids to calm down the inflammation in your airways. And some common brand names are Flovent, Qvar, Alvesco. Then you have some that are called combination medications. These typically have that mild steroid, but in addition to it, they have what are called bronchodilators, or medications that keep those air tubes open for 12 to 24 hours at a time. And some common brand names there are Advair, Symbicort, Dulera, Brio. We also now have a third category, the triple inhaler. One example is Trelegy. And then there is a category for long acting muscarinic agonists like Spiriva. These are the common controller inhalers. If you have one of these, more than likely you have to use it every day to maintain control of your asthma. Some non inhaler medications are tablets like Montelukast tablets, some injectable biologic medications for severe asthma. Examples are Xolair, Nucala, Sinclair, Fasenra, and Dupixent. And if your patient has moderate to severe asthma, your doctor may have referred you to a specialist who does one of these injectable medications, which are very effective and very safe for severe asthma and can be life changing. Many patients also will benefit from allergy shots or allergen immunotherapy if allergens are one of their main trigger for asthma. So whatever the medication is prescribed by your primary doctor or your asthma specialist, be sure to take it on a regular basis. Learn how to use your inhaler properly. Technique is very important for inhaled medications. If we don't use the proper technique, the medication will never reach the airways. So, for a lot of people, this means learning how to use it with a spacer, watching a video, and making sure that you're doing it properly. Quit smoking and avoid secondhand smoke. Cigarette smoke can be a very potent and irritant trigger for lung disease. So, it's bad for anybody to smoke, but particularly asthmatics need to quit smoking and avoid exposure to smoke. Exercise. So, building exercise tolerance is important, and this is a big factor in what you feel on a day to day basis in terms of your asthma control. Get an asthma action plan. An asthma action plan looks like the picture on the right hand side. Almost every child who is an asthmatic and goes to school has an asthma action plan that is kept at their nurse's office. But it's not a bad idea, even for grown ups, to get an asthma action plan so that they can know what to do when they are in their green zone, meaning their asthma is well controlled, yellow zone, mild symptoms of asthma, or red zone, meaning severe symptoms and you could be headed towards a dangerous flare up. So everybody can consider asking their doctor for an asthma action plan so that they have written instructions on what to do when their asthma flares up. Avoid viral infections because these are very common triggers for most asthmatic patients. How can you do that? Wash your hands properly and often. As we've learned in the pandemic, washing hands plays a big role in avoiding infection. Get your vaccinations, be it the flu shot, your COVID-19 vaccines, your pneumonia shot. Vaccination is one of the main ways that humanity has dealt with a lot of infections. Get enough sleep. It's very important to get good quality sleep. If there is something interfering with your sleep, like obstructive sleep apnea, this can often make your asthma very hard to control. If you do catch a viral infection, pay attention to your asthma symptoms and call your doctor. Some danger signals are that you don't get any relief when you use your rescue inhaler 1 or 2 times, you're up coughing all night, you're more tired than usual during the daytime, or you start feeling chest tightness. Don't hesitate to call your doctor if you feel any of these when you have a viral infection. SA Kids Breathe. This is a program that's available in San Antonio. This is a fabulous program, and anybody can refer children with asthma to this program. The contact information is on the screen right here. What services do they provide? They meet with families that have children with asthma. They provide some in home visits with a respiratory therapist or a social worker. They provide education. They provide a visits with healthcare providers, and they also visit the school or daycare. And they check with the family over an additional 6 month period if needed. There is no cost. This is a free program through the city, and they basically employ community health workers, certified asthma educators, and registered respiratory therapists. There are also translation services available for patients that may not speak English. And what will your patients learn about asthma? They will learn how to use their asthma devices. Their home will be reviewed for triggers, allergens, or irritants. They will learn about an asthma action plan. They will learn about how to use their medicine properly, and they can help connect you with the school nurse, the providers, any community resources that you may have. So now we will move on to the question and answer session of our program. And we have Dr. Diaz who will be joining us.
I think I'm in here now. Okay, am I good? So thank you, Dr. Karkhanis. That was a nice community service to do for our patients with asthma, especially during Asthma Awareness Month, right? Mm-hmm. That was one of the things that we like to do in our clinic. When you talked about asthma control, the title of our talk tonight was, is your asthma controlled? And you talked about the different questionnaires and things. But if I was to ask you, is my asthma controlled? How would you assess that? If I just came to you with asthma and said, is my asthma controlled? How would you answer that to me?
So the main things to ask yourself are you having asthma symptoms during the daytime? And cough, wheezing, shortness of breath? Are you waking up at night with asthma symptoms? Are you reaching for your rescue inhaler more than 2 times a week outside of pre-exercise use? How much do you feel your asthma is affecting your life? And then in most doctors' offices, if you're an asthmatic patient, we would do a lung function test and we would look at that. And we would also check your chart to see if you're having flare ups that require systemic steroids. So, those are the main ways to know, the main questions to answer that question: is my asthma controlled?
Yeah. And a lot of people still don't know. I mean, there's a lot of studies that have shown that over 50% of patients who have asthma, even with everything that you mentioned about triggers and medications, over 50% of the patients out there who have asthma are uncontrolled. Mm-hmm. And there's a lot of data that says that. So I know you covered it a little bit, and I know I'm asking you the questions, which is kind of a fun way to do this, but can you tell us again, in a very simple term for those patients out there? You already talked about what is uncontrolled asthma. And I like to use the rule of 2s. Whereas if you use your rescue inhaler more than twice a week, or if you wake up from sleep more than twice a month, that is considered uncontrolled. But if someone is having uncontrolled asthma, can you again review just like the main reasons why asthma is uncontrolled? Why these patients out there who have uncontrolled asthma, the main reasons that their asthma is uncontrolled?
The main reason asthma is uncontrolled is either there is a trigger that's not being addressed, or there is a need for medications more than the patient is taking. They're either not taking it properly, or they're not taking the right dose or right kind of medication. So some patients genuinely require a higher level of medication to control their asthma. If they are on a inhaled steroid, they may need to move to a combination inhaler. If they're on a combination inhaler, they may need to move to injectable medications or allergy shots. And then there are some patients who have the medication but either don't take it regularly or don't use it properly. And then triggers. Maybe we have not addressed your sinus infection that's going on. Maybe we have not addressed the pet dander that's in your home. These are very simple measures that your asthma doctor can help you with in order to improve asthma control.
Yeah, yeah. I remember we were talking a few weeks ago about the use of the inhalers and how only 30%, only 1 out of 3 patients knows how to use an inhaler correctly.
That is a very low number.
Yeah, and then the other thing is that even if you don't know how to use it, only a third of patients know how to use their inhaler correctly. So at every visit, we go over that inhaler technique. But let me ask you a different question. When someone has an asthma attack, almost all doctors use steroids. And steroids are very helpful, but we know that steroids have a lot of side effects. How many steroid bursts is reasonable for patients? With all that we've learned about the side effects of steroids, how even a short burst of steroids can cause side effects and how they accumulate, and a lot of the studies suggest that the side effects from steroids are now cumulative over time. But everyone's using steroids. I just read a recent study that showed that 30% of kids get at least one steroid burst a year for all kinds of conditions. How many steroid bursts is okay for you?
I think 2 in a year. Anything more than 2, and you and your doctor need to be talking about what you can do to avoid that third steroid burst in a year. Um, Whether you need more medication, whether you're not using your medication properly, what is going on with the other factors that affect your asthma.
Yeah, yeah. And again, I can't not overemphasize that using your medications correctly is important and getting your medications. When we look at pharmacy records that we do, and sometimes when patients aren't getting better, we'll request the pharmacy records to see are they filling their medications. And many, many times they're not filling their medications. So we have a question that just came in. And the question says, can triggers change with time and age?
They can. If you get rid of one trigger, you can develop new triggers. You can pick up new allergens. You may develop sinus disease later on in life. You may develop a condition called nasal polyps later on in life. So, triggers are not always the same throughout your lifetime. A lot of triggers, though, won't go away because something like a virus that triggers your asthma, you're always going to be exposed to some virus or the other in childhood and in adulthood. So, another question. What are some of the side effects from the steroids? Why don't you take that one?
Yes, Dr. Karkhanis, but here I ask the questions and you answer them. So absolutely, there's a lot of concern over the side effects of steroids. We used to think that a short burst, 4, 5, 6 days of steroids had very little side effects. But now we know, and we always worried about the effects of steroids over long term. I will see a patient and say, I'm going to put you on 5 days of a steroid, prednisone. And they say, oh, no, I'm not taking the steroid because my grandmother had rheumatoid arthritis and was taking prednisone every day and had tons of side effects. But that's not that's not the way we use them often in asthma. So some of the immediate side effects of steroids, even if you just take 2 or 3 days, you can get insomnia, you can get irritability, you can get depression. Very, very rarely, it can affect your blood sugar. It can affect your appetite. It can affect your potassium. And even rarer, it can affect your stomach, and people have been known to have bleeding episodes. So even in the short term, we try to avoid steroids unless they're absolutely needed. And I'm telling you that recent article I mentioned, that 30% of children in a year, 30% of all children in a year get at least one course of steroids is very concerning. Now, long-term side effects are the ones that most people hear about: weight gain, diabetes, high blood pressure, depression. All these things can occur in patients who take steroids over a long period of time. And there are many others. And there are studies that show in patients who have severe asthma that take daily steroids or even every other day steroids, There have been studies that have confirmed that their chances of diabetes and high blood pressure and depression and even suicide is much higher in patients who have gotten a whole lot of steroids over a period of time. I have another question. So I'm going back to asking you the question. So this person says that I've heard there are 4 types of categories for asthma. Is it possible to move up and down the categories? And I'm assuming they're talking about intermittent asthma and mild, moderate, or severe persistent asthma. So can you move up and down those categories?
Yes, definitely. Severity of asthma is different from control of asthma in that a person could have mild asthma, but it could still be uncontrolled, or a person could have severe asthma and it could be well controlled. And yes, categories can change once we get a good hold of what is needed to help you with your asthma and we control it. We often find, especially with therapies like allergy immunotherapy, we can make long term disease modifying changes in your body, and we can cut down on the amount of medications you need. And your asthma may actually go from being severe to moderate or moderate to mild. We also see some differences with age. Oftentimes, people will say, I outgrew my asthma in high school. And what that means is that they grew up and their lungs expanded and their airways got big, and they no longer had the mild asthma symptoms that they had when they were children. There are often people that once they are no longer very active and their lifestyle becomes sedentary in middle adulthood, their asthma symptoms come back. For a while, they had an asthma free period in early adulthood and adolescence. So, yes, your asthma categories can change. And that's why it's important to always know what medications you need to keep on hand. And if you've been instructed by your doctor that you need a controller asthma medication, to not stop it because you start feeling better. Oftentimes, you feel better because you're taking it every day. So, you got to keep taking it every day.
Excellent, excellent. So a very basic question is like, in general, it says this person asked, what does an inhaler do and why is it so important?
So the inhalers have medications, and the delivery system is trying to deliver these medications directly to our airways. Instead of taking a tablet that will then be absorbed into the blood and will go to all the organs of our body, the inhaler delivery system is trying to deposit the medication directly in our airways, which is where the asthma pathogenesis, the asthma mechanism is happening. The common categories of medications in inhalers for asthma are what are called steroids. And that is needed because asthma has as its main component inflammation in the airways. And so we need an anti inflammatory medication. And an inhaled steroid is the commonest category used. A big advantage over oral steroids is that these inhaled steroids deposit just in the airways. Very little really gets absorbed, and we don't see the long term or short term side effects that we would with an oral steroid or an injected steroid. Another category of medications in inhalers are what are called bronchodilators. So, albuterol, for example, which is a common rescue medication, inhalers can have short acting albuterol or a long acting version that will keep your airways open for 12 or 24 hours at a time. And for a lot of people, they require that regular intake of long acting bronchodilators to keep their hyperreactive airways open and to give them relief from their asthma symptoms. The main thing with inhalers, the importance of inhalers is that it's an easy delivery mechanism directly into the lungs, bypassing the blood and all the other organs. And if you master the technique and remember to use them daily, they have very few side effects. So, since asthma is a chronic long term condition and most patients require chronic long term medication use, you want to use a safe delivery system like an inhaler instead of doing oral medications that may affect the other organs of your body.
Thank you. I don't know how much more time we have, but I have another question here. What if I am taking all my inhalers and medications correctly and I continue to have asthma attacks? And they don't say this, but more than 2 steroid bursts a year. And even when I'm doing well, I'm still using my inhaler frequently, my rescue inhaler. What are the alternatives? I think you mentioned some of them in your talk. Like what are the alternatives for more severe asthma in patients who are taking their medications, who are following up with their doctor, and they're still waking up at night and they're still requiring steroids?
There are several very safe, very effective injectable medications that are called biologic medications. This is a relatively new category of medications, and the medications used for asthma in this category, the common names are Xolair, Nucala, Sinclair, Fasenra, Dupixent. Some of us might have seen commercials on TV for these medications, and you should definitely see an asthma specialist to see if you qualify for one of these medications. These biologic medications are what are called immunomodulatory. So they act in a different way than your inhaler or than a steroid. They try and target one of the steps in the inflammatory cascade that is going on in your lungs, to try and modify the underlying cause that is triggering your asthma in your lungs. Some of these medications target a molecule called immunoglobulin E or IgE. Some of these target a specific type of white blood cell called the eosinophil. And these are excellent options for patients that have already tried all their other medications, are being diligent with use, and still have trouble with their asthma.
There's one great question that I just read that obviously this is a very important time because of the pandemic. So the question is, if I have asthma, if my child has asthma, who's 12, who's 16 and 14, so this person has two children, they have asthma, and they're asking, should my child with asthma get the COVID vaccine?
Definitely. The COVID vaccine is very important for asthmatics of all ages. And now that it's available in the US to everybody ages 12 and above, yes, your children who are 16 and 14 and have asthma, the COVID-19 vaccine is one of the best ways to protect them from COVID-19 infection. And invariably, most asthmatics who catch a virus like COVID-19 are going to have trouble with their asthma while they recover. So the COVID-19 vaccine is a very good and important measure for all asthmatics. Get it.
And actually, our practice is offering the COVID vaccine for children above the age of 12 on today, Thursday, Friday, and Saturday. And I don't know how many more doses we have left. A lot of people have been taking advantage of that, which is, I agree with you. It's very, very important.
And you don't need to be our patient to get the COVID-19 vaccine with us. It is available to everybody ages 12 and above.
Beautiful. Well, that's all the questions we have. I thought you did a fabulous job. Thank you for letting me ask the questions. I like this format a lot better than me having to do any presentation. I thought you were great. And thank you all out there, whoever stayed on with us. We hope you find this valuable. This is really a community service. It's not to market anybody specifically. But if you really have bad asthma and it's uncontrolled, or you have questions, you should see an asthma specialist. It's very, very important that you see someone who treats a lot of asthma. Asthma can be tricky and can be funny sometimes. So on that note, again, good night, and thank you for staying on board with us.
Thank you. Have a nice weekend.